Hello, everybody, and welcome to the second episode of the PSS podcast, brought to you by the Partially Sighted Society. Today, we're going to be talking about the condition floaters. If you need to know any more information about this condition, you can contact us on 01302 965 195, or you can visit our website, partsight.org.uk. I will now pass you over to Anita Plant, the CEO of the Partially Sighted Society, to get the podcast started. Anita.
Thanks, Sean. Okay, so my name's Anita Plant. I'm the CEO of the charity. And we've also got Nickie.
Yeah, hi everyone. I'm Nickie. I'm the mental health and wellbeing practitioner here at the charity.
And we've got Gary.
Yeah, hi. My name's Gary Flack. I'm the optometrist at the Partially Sighted Society.
And today we're also joined by Andre, who's going to give us his personal experience of what we're going to be talking about today.
Hi, I'm Andre, and I do the printing for this Partially Sighted Society.
Thanks, everybody. So today we thought we would talk about the condition floaters. I'm sure everybody has seen those little irritating wiggles that appear in the corner of your eye when you're hanging out the washing or on a bright sunny day. And I often wonder, what they are. Are they anything to worry about? So I'm going to ask Gary, what are floaters, Gary? Why do they occur? How do they affect our vision? And when do we need to be concerned?
Okay, well, a big wide subject though, the floaters. Floaters are actually debris or collagen debris that comes from the vitreous, and it's as we age, our vitreous, which is the gel inside your eyes, shrinks and actually tugs a little bit at the retina, and that pulls away little parts of it. And then you see a shadow of them. So if it's bright outside, you cast a shadow on the back of your eye. There's quite a few variants of them, but that's the main one. And that type of floater is nothing to worry about.
So the vitreous in the eye. So would we say that the vitreous gives the eye its shape?
Yeah. So the gel inside the eye actually is a bit like having a balloon with water in it. It actually gives the balloon the shape. But as it shrinks, then the eye still keeps its shape. So this is where the floaters occur.
Okay, right, that's great. I get a few floaters. I don't know about you, Nickie.
Yeah, I do. A few little annoying ones as I'm getting older.
We don't use
creeping in.
Yeah, we're getting wiser, not older. Yeah. Are there any conditions that cause more floaters than normal?
Yeah, it's more important how quickly the floaters develop. So if you haven't had floaters and then suddenly wake up one morning with the floaters in one eye, then there is a potential for a bigger problem than just simple floaters. So it's how quick it occurs. But also if you get them in birth eyes, it's not often the eye, it's more the brain side of it. So there's a few factors with that as well.
So what would they be, those factors?
Migraines, things like that, yeah.
Okay.
Also, if they become more of a black blobs in your vision rather than little wiggly things that move around, potentially it could be a blood pressure that's altered or raised. So that's something to certainly have an investigation about.
So high blood pressure would affect our vision?
Yeah, but they would be more like black blobs, but they're still sometimes interpreted as floaters. So floaters are usually little wiggly things where you move your eye and they catch up your vision. So they're a bit like a lacy curtain, whereas the differential to that is usually the black blobs are in birth eyes, and they're actually black blobs rather than little moving ones. And they move with your eyes rather than actually having a bit of a lag behind them.
Okay, so like floaters will float, and anything else will stay fixed.
Well, that's basically what happened to me. I suddenly developed these right at the bottom of the eye. It was large black sort of. They kept moving the whole time, almost like an octopus's tentacles, to and fro the whole time. And then big black ones moving across my eye. Just suddenly happened.
So what did you do?
Well, I was really scared about it because it's something I've never experienced before, and I came to see Gary about it, and we discussed it, and he had a look, and referred me to the Doncaster Royal Infirmary for treatment. Well, I went to the hospital, and after seeing the ophthalmologist, they gave me eye drops, several sets. It seemed to be quite a few eye drops numbing the eye. I then went sat down and they had this lens that they attached to my eyeball, just quite comfortable. Odd, I'd never expected that. But she explained to me that this is in order for them to see right around the top of the eyeball where the retinal tears were. Fairly uncomfortable, but not painful or anything like that. And then I went in for laser surgery, and it was interesting because it was these green flashes, and they were different in intensity. It just felt like a push against my eyeball the whole time. Not painful, but just vaguely uncomfortable. And that was it.
How long did it take in total?
About 20 minutes.
Okay, and afterwards?
Afterwards, no
Any
pain
pain?
at all, nothing at all. Just told not to pick up anything heavy. I'm a keen mountain biker, and I was told not to.
For how long?
For about 2-3 weeks. I then had a follow-up with the ophthalmologist again, where again they attached this lens to my eye so they could see. Don't know how it works, but anyway, it was necessary. Again, vaguely uncomfortable, but by now I'd expected it. And they were very happy, and everything's normal now.
Great.
All in all, a painless experience, but a vaguely uncomfortable one.
So, Andre, you've had all that done. How's your vision now?
Perfect. Absolutely perfect. It took a while for them to disappear, but it was just a gradual process, and they just seemed to go away. I'll still see them occasionally, but
you're
no
now
problem
having
now.
to look for them a little bit more, aren't you?
Yeah,
Rather than
yeah.
Before it was always in your vision, which actually can be quite alarming. And certainly from a psychological point of view, having things that event like that, it can have some kind of. I think Nickie can probably help us out on that one.
Yeah, it's a tricky one because I think, there are these different conditions, as the guys have spoken about, that can cause these floaters and different types of floaters. But there are quite extreme cases sometimes where people's floaters don't necessarily settle. They sort of do move about. They're there all the time. It's one of those things, I think, with an eye condition where, as soon as you wake up in the morning, you might notice that condition and it doesn't quite leave you. Yeah, so it's one of those things that people sometimes can't feel like they can get away from, and that kind of reminder can affect them, especially if they're not feeling mentally at their best anyway, and they've got things like anxiety and depression that can just make having that eye condition just that little bit more impactful. So I do a lot of work with people around, giving their sort of eyes a break, if there are things that they can do where they focus on their other senses, that can be quite helpful. Wearing sunglasses, wearing a blindfold just for a short period of the day can be really, really helpful, just to sort of distract you from those floaters that, especially if they're feeling quite, just really, really getting you down and really, really frustrating. For lots of people though, the brain is really wonderful at sort of ignoring and compensating for things that might be going on in the vision. So it's not everybody, it's not really common. It is in quite severe extreme cases that it can really affect somebody psychologically, but it's always something that in my job I have to be quite mindful of.
I always back that up when I'm doing an eye test as well, that if anybody has had a detached retina and seeing those floaters, that they will subside, the brain gets used to them, a bit like saying your nose is there. You don't notice it until, in fact, Sean's closing one eye and opening the other now to so now Sean sees it, you can't ignore it now. So the brain is really wonderful in the sense that it will suppress things, and once it's always there, it'll tend to ignore it. As I said, the key part is this sudden onset, particularly if it's one eye, or it actually has any any flashes with it as well, then that would be quite significant. But as I said, most of the time these floaters are quite normal, just part of aging, really. Some of the things when I talk about help would be, good sunglasses. That definitely helps. A broad-brimmed cap or hat, that sometimes helps as well. And occasionally we ask people saying, when they're really getting frustrated about these floaters, is there an operation? Can't you exchange the vitreous? And the kind of answer to that is, it's a very, very tricky operation that they would only want to do if there was a risk of you losing your sight if they didn't do it. So in fact, it is one of those that you kind of have to put up a little bit with, but the ramifications of actually doing an operation on that are quite high. In which case it's not something that they do naturally. As I said, unless there is a risk that you're actually going to lose your sight.
There's very little guarantee, isn't there, from what I'm aware of, that actually does what you want it to do anyway.
It does, yeah.
Yeah.
Practically, I kind of find that if I'm concentrating or spend a lot of time looking at the computer or a screen or a phone, that I tend to notice them a lot more. So the 20-20-20 or 20, is it the 20-20-20
There's quite
rule?
a few 20s there.
Is something that I do try to utilise. Perhaps Gary can explain about what I mean by that.
Yeah, so the 20-20-20 rule is every 20 minutes, take 20 seconds looking at 20 meters or yards, because they're not that much different. And the idea is that we just give our eyes a little bit of a break. The way that I describe that, if you were to sit on the computer looking at the screen, your blink rate drops quite a lot, your eyes get a little bit drier, and after about an hour it's a bit like sitting on your legs for an hour. When you stand up, they're not your legs anymore. So if you actually have every 20 minutes, you just have that 20 seconds looking away. It's the equivalent of kind of shaking your legs out, which means that you can sit back on the floor and carry on for another 20 minutes. So just having that break. Before we had the COVID in 2020, we used to say to people every hour take 10 minutes off, and even I was guilty of not doing that, and I know all the ones around the table would agree with me. It's not something you do because you're busy doing something, particularly as your boss is on your back. I'm only kidding. So the 20-20 rule was something that was developed to help out, and in fact for kids we actually talk about the 20-20-22 principle. So that's every 20 minutes, 20 seconds looking at 20 meters and 2 hours outdoors.
Oh, okay.
Okay, so we need to get them outdoors, away from the computer. I remember seeing that on a podcast, or listening to that on a podcast, and the person that was telling me that was actually, it was mid-February and he was in Shanghai, and it was about 110 degrees, whereas I was sat with 3 jumpers on in the house. That's not going to happen.
I'm not getting out there.
That's not going to happen. But ideally, that would be the scenario that we have, and that's actually a good break, just from a psychological point of view, as well as a practical point of view as well.
And blinking again. We spoke about blinking last week.
Which we dry eyes, which we talked about last week. Okay.
That's great. I think thanks, Andre, for sharing your experiences with us today. Has anybody got anything else that they want to add, Nickie?
No, I don't think so.
Gary?
No, I'm good.
Yeah, that's it. So if anyone's got any questions about what we've discussed today, Sean will be providing all the information about how to contact us.
Thank you, Anita, and thank you to the team there, Gary, Nickie and Andre, for the interesting discussion there. In a future episode of the podcast, we're going to be opening up to questions, so if anyone's got any burning questions about any sight condition or any of the work we do at the charity, feel free to either give us a call on 01302 965 195, or you can drop me an email. That's Sean, SHAUN, @partsight.org.uk. For more information on the work we do, you can visit our website, partsight.org.uk. Thank you again for joining us for the PSS podcast.